Hello, my name is Patrick Barron. I am the CEO and co-owner of Franklin Rehabilitation. We are a physical therapy clinic located in southeastern Wisconsin in the Milwaukee area. The thing I wanted to talk about was the successes I've seen in using the patient compliance course that we received from Measurable Solutions. To give a little background, back in 2013, we took the new patient course from Measurable Solutions. The reason was that we were only averaging around 200 to 220 patient visits a week, which was a drop from what we were used to. After doing that course, we worked our way back up to an average of 230, 240, and at one point we even hit 290. But the problem that we were having is that our patients wouldn't show up for their appointments. So we were at an average arrival percentage of maybe 85%, high of 88%, and at times we drop as low as 82%. So of those maybe 230 visits, we had another 30 to 40 patients that were canceling every week. And it was really causing a problem with our operations. Since the new patient course was working for us, we decided to go forward and try the patient compliance course. And when we did that, we went all in and we had the trainers come up and train all of our staff. So we had all the therapists, PTs and PTAs, and all the receptionists receive the training. We had the approach that we wanted to give it our all. We didn't think that it would work if we didn't try, so we went all in and had all the staff trained. The thing that I realized when we took the training is that we had really gotten to a point where we were letting the patients drive. They would come in and they would have these reasons why they couldn't do therapy. They've got a $40 copay, so they wanted to do once a week instead of twice a week. Or the insurance would only authorize them 8 visits and cut them off, and they didn't want to switch to a self-pay plan. Or we would try to schedule them for the initial eval, but then they call back and say, yeah, I think that out-of-pocket's too high, I'm not going to do it, or they had a deductible or whatever it was. At any rate, prior to the training, we had all these reasons that we were going along with, and they made sense to us because the patient was struggling. We don't want to put them out financially. We wanted to make sure that they were doing well, and you know, if we just showed them a few stretches, maybe that would be okay and they'll get by. Well, we go through the training, and what we really realized is we were not doing our patients a service. We were actually taking treatment out of their hands. We were giving them a watered down version of what we're good at, and as a result, they didn't get the same. Their expectations really were not met to their full satisfaction. And the problem with that is our name was on it. So we would be giving them these partial treatments that we're not getting the results that we used to get, say, 10 years ago, and then that's all that the patient could talk about. And it was kind of branding us that we would do partial care and not get full results. So we went through, we did the training, and we had an immediate increase. The very first week that we came back after training, we jumped up all the way up to 96%. Everybody was doing the skills they used in the training right away, and it was an immediate increase. So we gained probably 30 patient visits in the first week simply by getting everybody to show up for their appointments. So that was really big. Since then, in the last 2 years, we've continued to use that, and we're now averaging from mid to upper 90s of arrival percentage every week. We've also grown our clinic visit average, went from 230 to now we're roughly 430 average per week. And then on top of that, our highest point ever we hit last week was 450 patient visits. So we're regularly doing more patient visits, we're getting them to show up, and because they're actually here working with our therapists or the experts, their problems are actually being fixed as opposed to just being worked on. And now our name is on a much more valuable product, because when they leave our clinic, they have only successes themselves to share with their family and friends and doctors. Whereas before they were, yeah, I learned some good exercises, but you know, it's still kind of there. And that's really the difference is we're in a market where there's lots of physical therapy clinics, and our patients, since they stick around until they're fixed, they're comparing themselves, and their doctors are comparing them to patients that are still being leaked out of other clinics just because there's so many reasons for them to not stay. So for me personally, it's been an incredible experience. It's kind of demanded that I get into other areas of the business, which has been excellent for me. It's opened up lots of opportunity for myself. And then for all of our therapists, and our staff continues to grow. Every single week we're helping more patients, And it's all, I believe, the result of us taking this patient compliance course. So I'm very, I've got a lot of gratitude for Measurable Solutions to offering us the course and taking us through the training. And for anybody who does take the course, if you do it, it will work. The main thing is, like any other course that you may learn in like physical therapy skills, if you apply it to your patients, you'll probably get results out of it. But if you drop the things that you learned out, it will drop out. So as we're looking at our statistics, at times our arrival percentage will drop down near 90% again. And as soon as that happens, I get our book out in our staff meeting, we start going over it. I find there's points that certain staff members have forgotten about and they're not doing regularly. They all do it again. We do drills to get it back in, and the very next week we're back in the mid 90s, upper 90s again. So it's the kind of thing that if you're committed to trying something and training the staff and staying on top of it, it will work. So again, thanks to Measurable Solutions for giving us this incredible tool.